Hello and welcome to Q&A with CNA. I'm Kyle Schwartz and my guest today is Dr. Elizabeth Hayford, and we haven't been with you for several years, but welcome back to the program.
You. Happy to be here.
All right, so since it's been a while, why don't you refresh us a little bit about your position and also like where you grew up and went to school and that type of thing, a little bit about your background.
Sure. So right now I'm the medical director at John Adolescent Behavioral Health. I'm from Central Ohio, grew up in a small town. We had 3 stoplights, Fredericktown. And my dad was a family physician. His office was in our house until I was in 2nd grade. So I knew that I wanted to be a doctor as long as I can remember. I went to medical school at NeoMed, which is local. And then I actually did family medicine first. And did residency down in South Carolina. Moved back to Ohio for family. And then my favorite people to see had depression and anxiety. And so I went back and did psychiatry. And then I really do love families. So I did a fellowship in child and adolescent psychiatry at Akron Children's.
All right. So. Well, all that relates to your job now, even being a family practitioner. I mean, relating with families.
Exactly.
And all that has really made you a well-rounded person in your job. So you run the Psychiatric Services Department. So what services do you provide there?
So we have 3 nurse practitioners. In addition to myself, we have an RN and a medical scheduler, and we see people to do like psychiatric evaluation, so a new visit to help determine diagnoses and if medications are appropriate. And then we do follow-up appointments, which are primarily medication management.
Okay, and where do you see your clients?
So we see them, we have 2 offices that we see medical service clients, and that's at our Belden office, which is close to Roosters, if you know where that is. And then we have an Alliance office, which is off of State Street.
Right. Okay. All right. And then do you have, you mentioned the other people that work there, but do you also have interns, and then what do they do?
We do. So we have primarily 2 different kinds of students. We have nurse practitioner students, and often they'll shadow to start off with, and then as they are there longer, they might lead the interview, but either myself or the nurse practitioners are always right in the room with them. And then we also work with Altman Hospital, so we have some family medicine residents that will rotate through and pretty much do similar shadowing and then interviewing.
Okay. All right. So you can prescribe medicine, but in addition to medicine, would they be getting psychiatric help as well? Counseling? I don't know how to put it, but
yes.
In addition to the medication.
Yes. So for the lion's share of people that we see, medication is just one small piece of the puzzle. Oftentimes people benefit from therapy services, or we have, they're called qualified mental health specialists, previously called case managers, who can come alongside. We also have peer support. So if people have had mental health challenges themselves, can sort of walk you through it. And we also have family peer support people.
For the family members of the client.
Yeah, exactly. And then we also have a huge prevention team that works with local schools and the YMCA, because if we can help prevent things from getting worse, that is great.
Yeah.
Yes, and there's also a program called Triple P, which we are bolstering, which is the Positive Parenting Program, and that's to help parents with challenging situations.
Just being a parent.
Exactly.
Yeah.
Exactly. How to handle like tantrums and grief and different situations that your child might be in.
Okay. Well, from previous guests, we know that CNA serves 0 to 24. Do you work with that wide of an age group as well?
So we will see new people anywhere from the age of 3 to 18 and in high school.
Okay.
Accepting new people.
Okay. Is CNA the only children's agency that can prescribe medications for patients?
No, we're the only solely focused on children and adolescent agency, but ComQuest and Phoenix Rising also can prescribe medications to children and adolescents, and Coleman is working to
I'm getting that.
build their child and adolescent program.
Okay. On a day-to-day basis, what's the most rewarding part of your job? What do you like most about what you do?
I love to help people, and I love to help people see the value that they have and how they can positively impact the planet. And so I think just helping people realize how much potential they have is the most rewarding part of my job.
And on a day-to-day basis, how many clients do you see a day?
So I personally will see between 7 and 14. Our nurse practitioners see anywhere between 12 and 16 people in a day.
Okay. And how long have you been there?
5 years this summer.
Okay. All right. Well, you made it through COVID and
We
before
did.
and after. And
Yeah.
All right. Well, anything else that you wanted to add today?
I just wanted to add that September is Suicide Prevention Month,
Okay.
and so that if anybody is struggling with suicidal thinking, or if you know somebody who is struggling with suicidal thinking, of course our agency is here to help. But also there's a new emergency line, 988.
Okay.
So people can call that. It's similar to 911, but for mental health. So again, if you're having suicidal thoughts or know somebody that is, call 988.
That's a lot easier than suicide prevention lines
Yes.
before. 988, you can remember, yeah.
Exactly.
Okay. Well, Dr. Hayford, thank you so much for coming back and telling us more about your job and helping out us to understand more about what child and adolescent behavioral services is all about.
Thanks for having me.
All right. And thank you for watching Q&A with CNA. I'm Kyle Schwartz.